Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, along with nursing student Gina Peter. And today we're talking about Lyme disease, what it is and how to prevent it, along with other tick-borne illnesses. I'd like to welcome to the show Dr. Alexis Chesney, a neuropathic physician and acupuncturist specializing in Lyme and other tick-borne diseases, and author of the book Preventing Lyme and Other Tick-Borne Illnesses. Dr. Chesney, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you, Jeanine. It's great to be here.
So let's start out with, and I hope you're doing well, can you tell us how you may be personally impacted by COVID-19? I know this is something that impacts everyone.
As a physician, I certainly have been impacted in my practice in seeing patients with COVID-19. Luckily, we don't have many patients up here in southern Vermont, where I work. I'm originally from Long Island, but I work at a clinic in southern Vermont.
Oh, where are you from in Long Island? Where are you from?
So I am originally from, first I was out in Dix Hills and then Manhasset.
Oh, wow. Okay.
Yeah.
All right.
Yeah, and I remember I took a class at Nassau Community many years ago, right after, or during or after college, when I was away at college one summer. So,
so it's a full circle moment. Yeah.
Yep.
Okay, so tell us what is Lyme disease and how do we get it?
Lyme disease, after actually Lyme, Connecticut, is where it was first discovered in some young people who were thought to have juvenile arthritis. And then it was found actually this bacteria called Borrelia burgdorferi was causing an infective arthritis in these kids. And so the name then became Lyme disease after the disease that is caused by Borrelia burgdorferi, a bacterial infection that then causes symptoms like arthritis as well as other things.
What are other symptoms, and how do you test someone to see if they have Lyme disease?
Right, good question. So there are two ways of looking at this. The acute presentation, when somebody gets bitten by a tick, and then symptoms they may have right afterwards. And then there's a chronic presentation. So I work with a lot of people that have chronic Lyme and tick-borne diseases. So it's a little different. But why don't we start with the easier case of an acute tick-borne disease. Someone might have a tick bite, and then within 30 days develop symptoms like flu-like symptoms, chills and sweats, fever, body aches, joint pain, even joint swelling, headaches, fatigue. These are some common symptoms that could come about with Lyme disease. And so then testing isn't very accurate right away if you were to test initially when these symptoms start. So I think that's really important to note. And it really takes 4 weeks for antibodies, 3 to 4 weeks for antibodies to be to develop in the immune system in the body and therefore be caught on a test. So really, if somebody has that history of a tick bite followed by these symptoms, or if they get the classic bullseye rash, which does not happen all the time, it happens less than 50% of the time, but if it does, this bullseye rash, which isn't always a perfect bullseye. It could be a solid reddish, pinkish color. And then I think it's really important to note that it's not always, in that way of what a bullseye looks like, right, with that central clearing. And then depending on the color of one's skin, it can be hard to find. So I think it's really important to get people educated to look for that rash and how it can look different from person to person, and that it doesn't always happen anyway. But if it did, that would be really important to note. It always starts off small right around the bite, if it were to happen, and then spread out. So it's called erythema migrans, because erythema means pink, pinkish, reddish, right? And then migrans is migrating. So that's the name of this particular rash that is hallmark of Lyme when it happens again. And then so really it's looking at the clinical picture in the beginning and starting treatment right away. Anaplasma is also a tick-borne disease that's pretty common in your area and up here in Vermont. And so that's a similar treatment as Lyme, so that's a good thing. The testing for that is accurate in the beginning. So the anaplasma test is an anaplasma PCR that one would do within the first week or two of these symptoms. Anaplasma symptoms can be more like a high fever, so over 102 degrees Fahrenheit, and a headache that just seems like the worst headache one has ever had. Usually these people go to the emergency room, and so they're often caught, because they do the testing. The testing's accurate. The course of treatment is 2 weeks of doxycycline. They get that, and usually they do really well. So anaplasmosis can be pretty awful to experience acutely, but is also very well treated and does not lead to chronic issues. On the other hand, Lyme is very complicated sometimes to catch, to properly treat, and prevent those chronic symptoms.
So when we're talking about tick-borne illnesses, would you say that if you are hiking or in a very wooded area, you're more predisposed to these kind of tick-borne illnesses?
Well, thinking about the tick habitat, like you're mentioning, if you're hiking out in the woods, that's a place that ticks like to be, out in long grass. They love that. But it could be just walking across the lawn at school, at work, at home. It doesn't take much at a park. Mm-hmm. The mice and deer on Long Island carry these ticks as well as other small animals. And so it's really easy to come across a tick, unfortunately, in that area. So, of course, having mindfulness when you're doing those types of activities that you just mentioned, but even being in your yard, if you have one, or, sitting outside somewhere in a park or walking down the street onto some lawn, those things could even make you at risk.
So after we are, outside, outdoors, would you suggest that we are inspecting ourselves for tick, and how often are we doing that? I know this is something that a lot of people are not mindful of, but what do you suggest in terms of assessing ourselves after we come in from the outdoors? Absolutely.
Tick checks are essential. So if you're anywhere that a tick might be, which could be in grass, basically, on cement, they're not going to really survive on cement very long. So, thinking about your location, like if you are in a place where the ticks may be, then it would be, I'd say every day, or if you're on a long, if you're outside for a period of time, then I would definitely do periodic checks through the day, at least on the body part areas you could do. And then at home at night, to really do a thorough check. So looking under the arms and the groin. They love moist areas, dark areas. So, those areas I'm thinking about. And, places like the ears, like kids, if you think of kids like rolling around the grass or something like that, thinking about the ears, the scalp, a lot of times kids come in with ticks there. And if we see the tick, how do you suggest that we address it? If we actually will visualize the tick, how do we remove it? Should we remove it? And talk to me about that. Yes, absolutely. I would remove it as soon as possible. Tweezers are pretty hard to use. They just kind of mutilate the tick. And really, when we agitate the tick, it may regurgitate these pathogens into us even more. So thinking about as a smooth and easy experience with removing the tick is a good idea. I use something called OTOM, the tick twister, which I can share information about later if you'd like. You can Google you spell it. OTOM? OTOM is O''Tom, T-O-M.
Okay.
The tick twister. So it has this way of sliding under the tick mouth parts that are stuck in the skin, and then you just twist up, and it's amazing. It comes off really easily.
Oh, wow.
This is what I use in the clinic. I recommend it for all my patients.
Where do I find this? Is this
So,
any CVS or Walgreens, or where do I find it?
I don't know. I know it's kind of esoteric. You can find it online. In my book, Preventing Lyme and Other Tick-Borne Diseases, I have a resource section, so I mention these in that book.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, along with Nassau Community College nursing student Gina Peter. And today we're talking about Lyme disease, what it is, and how to prevent it, along with other tick-borne illnesses. So just continuing with what we were talking about, and if we see a tick on the skin, typically what does that look like? What does a tick look like? How does the skin appear around the tick? Talk to us a little bit about that for those of us who've never seen a tick in the skin.
Sure, yes. I mean, I highly recommend looking up pictures. I want people to really get equipped with the information they need in order to identify these ticks, because they're small, right? So the ticks in this area that we have are usually the blacklegged ticks, which are also called the deer ticks. Now, when it's there are three different life cycles, right? So they live for about 2 years. The larvae are the smallest. We're probably not going to see them bite a human. They're the size of a period at the end of a sentence. So small.
Wow.
Then they molt into nymphs, which are then the size of a poppy seed, and they're black. So hard to see. And then the next stage is the adult, and that is the size of an apple seed. Now, the females have this nice reddish tan back. They still have the black dorsal shield, which is this part, which if you can go online and look for it, is the best way to identify a deer tick. But it's really nice that they have that sort of flag of this reddish tan back, and those are easier to find when they're bigger, of course. So you've got to really look well. So they put the mouth parts into your skin, and then over the next 3 to 5 days, they will engorge and then fall off on their own. So they get bigger and bigger with your blood meal. Still not that big, but it'll distort that coloring of that reddish tan back in the adult deer tick that people often identify the tick with, but is not really the best way to. So if you were to use tweezers, if that's all you have, or if you get something like a tick twister to take that off, then you should keep it and think about sending it out for testing. After you remove the tick, you can use just an antiseptic like alcohol, or I use a lot of herbal medicine in my practice, and I use something called andrographis, a particular herbal tincture, because it actually kills Lyme. So if you put that right on the surface of the bite, it usually helps the bite heal as well. So the bite from person to person sometimes is itchy, or sometimes is a little red, a little irritated looking, and sometimes not. Everyone's different. That part doesn't really tell us anything about disease transmission. Yeah. It's really the things earlier that we talked about that are talking about disease process.
I'm just thinking about one other thing is, when I am anticipating going in the yard, is there anything that will deter the tick from biting me? Can I put anything on the skin that would prevent that tick from wanting to, attach to me or to latch on to my skin?
Absolutely. Yeah, so looking at using repellents. So there's DEET. We're all pretty familiar with that. I also like to use natural products as an alternative. So there's something called cedar side. Cedar, C-E-D-E-R. And so that's an essential oil. There are a lot of different essential oils that people use. Studies vary, showing efficacy. I really like the cedar. You do have to apply it more often than DEET. And so it is safer to the skin, not neurotoxic, which is nice to us, but repels the ticks. The next thing is permethrin treatment of clothing. That's huge. There are a lot of studies behind that showing that it's decreased tick bites by 93% in this group that was studied, that are workers that are out in the forest all day. So that was really interesting. So permethrin, if you put it on your skin, is toxic to our skin. So we don't want to do that, but we want to treat our clothes and our shoes, your tent if you're a person that camps, your equipment like your backpack, if that's going to be laying out in the grass or something like that, a blanket if you want to put the blanket down on the grass and sit on it. So these are some good ideas. If you have a dog, thinking about they make these little dog shirts, or you could, do a bandana around their neck, treat that. So you can treat your own, or there's a company called Insect Shield. They're awesome. They sell clothing with it already impregnated in it.
Oh, wow.
Or you send your own clothes to them, and then they treat it with permethrin, and it lasts a lot longer, 70 washes in the washing machine when they do it versus when we do it. If I just do it out in my backyard, it's going to only last 6 weeks. So I have to do it every 6 weeks. But that's a great thing to put on the calendar, which I do. I get all the shoes and sneakers out, spray them down in permethrin, keep everybody away, wear gloves, be careful, let it dry. When it's dried, it's safe for us, and then do it again in 6 weeks.
Where in the U.S. and the world is it more likely that you can be infected by a tick-carrying Lyme disease? So is it more like in New York, Northeast, or can you go into the Midwest and be at risk for Lyme disease?
Yeah, you are at risk at any place that has these blacklegged ticks, or else there are western blacklegged ticks that are in California and the West Coast. So it's mainly the eastern coast, and then now more so on the West Coast, but also there's quite a section up near Wisconsin, Minnesota. So anywhere these ticks are, which in the book I have a lot of maps because I want people to know that. So if you do travel somewhere, you can look up, hey, what ticks are here? Because there are other ticks in other areas that carry different pathogens. But especially in the Northeast, the black-legged tick and Lyme disease are the biggest problems.
So now with Lyme disease, how we talked about Lyme with the early symptoms of what we will see with the disease. How progressive is Lyme disease? And are you seeing in the hospitals people infected with Lyme as you have? And how has this disease progressed over time?
Do you mean progressed in an individual, or?
Progressed in terms of incidences in, right? Do we see a uprise with Lyme disease, or have we seen a decrease because of awareness?
Yeah, there's definitely a rise in Lyme disease in the Northeast as well as around the country and through North America. It's spread up into Canada now and throughout the world. In Europe, there are other strains. So it's more and more of a problem. There are 300,000 new cases of Lyme disease every year.
Is the only way to get Lyme disease from a tick, or can you get it from close contact like with COVID?
No, it's just tick-borne
Yeah.
at this point, yes.
Yes. So what is the later symptoms of Lyme if it goes undetected?
Yeah, that's where we really see a lot of problems with chronic illness. So a lot of neurological symptoms could come up. People can continue to have migratory joint pains. So joint pains that move around is really classic to the Lyme disease diagnosis. So if somebody has, I have, shoulder pain today, but then it's gone, and tomorrow I have knee pain, and then maybe that lasts a few weeks, and then I have the other knee hurts, and it doesn't really make any sense, for any other diagnosis. So that's very classic. And then other classic symptoms would be tingling and numbness, like neuropathy, and those even come and go, which is very unusual to any other disease. So maybe in the hands, the arms, the feet, even just random spots on the body. And those can come and go, as well as muscle pain. So those three symptoms are the classic ones. And then other neurological symptoms can then come about. A lot of cognitive issues, mood changes, neuralgias like nerve pains. Yeah.
Do you find that often Lyme disease is misdiagnosed or underdiagnosed? Possibly patients are said to have arthritis or other neurologic illnesses rather than we able to say that it is Lyme disease. You find that it's misdiagnosis there often with this.
I do,
illness.
Unfortunately. Yeah, and of course I see the people that have had that happen. They may have seen 20, 30 specialists for certain joint pains. They've had x-rays and scans and tried all these medications, and they don't know why.
Yeah.
And then we find, sometimes, right, not always, but sometimes we find, hey, it's actually Lyme, and we can treat it and you can get better.
That's great. So in your practice, tell me about your practice specifically. People come to you when they have been diagnosed with the Lyme or tick-related illnesses, tick-borne related illnesses. How do you come into play with the practice that you're doing and the work that you're doing?
Yeah, sometimes other physicians or practitioners refer to me. A lot of times patients come to me on their own who have heard from a family member or a friend who has gone through something similar and who thinks, hey, maybe these symptoms that I have that are very similar to my friend, it's actually caused by Lyme. You know, they got better. They figured out actually it was Lyme causing their symptoms, so I want to check out what else could be going on for me. I see a lot of people very frustrated after many years of trying to discover what the cause is to their pain and other symptoms.
Is Lyme disease, you talked about the other tick-borne illness. Are there any other tick-borne illnesses? I know you spoke about another one. Tell me about other tick-borne illnesses.
Babesiosis is another big problem. It's not as high in incidence as Lyme or Anaplasma, but we're seeing that it's more and more of a problem. And it's actually a protozoa or a parasite. So it's not a bacteria, and so it's not treated the same as Lyme or Anaplasma. So that makes it tricky. So if somebody, for instance, you could have more than one. You could have all three, you know. So that makes it tricky too. So if somebody is on Lyme treatment, and you know there are certain symptoms that don't get better, then especially with a particular constellation of symptoms, I might think about babesia, which is the protozoa that causes babesiosis. So we might do some particular testing for that. And we may need to treat that, which would use different pharmaceutical antimalarials is what they'd be called, usually something like Mepron and azithromycin. And I also use a lot of herbal medicine, like I mentioned. Yeah, so that constellation of symptoms would be something like chest pain, air hunger, night sweats, palpitations. And of course, there are other reasons for those types of symptoms, right? So these people often need to get worked up by a cardiologist. And I'll see people after they've gone through all, EKG, echo, Holter monitor. We don't know what's going on. And actually then we might find babesia and treat it.
Wow. So thank you for your work. That book, Preventing Lyme and Other Tick-Borne Illnesses, it is so important to know that we're just very familiar with Lyme, but it's good to know about everything else that is connected to tick-borne illness. So Gina has a question for you.
So one question. I knew someone with Lyme, and they were avoiding eating red meat. Can you explain if there's any correlation between Lyme disease and red meat?
Right. So actually, Lyme disease and not being able to eat red meat, having that allergy, are not directly associated. But you could get both, right? So you could get Lyme disease and then also get this allergic reaction called alpha-gal syndrome, which is an immune reaction from the tick saliva. So it's not a disease as in an infectious disease that's caused by a bacteria, right? Okay. It's a syndrome that some people, not everybody, some people come into contact with the antibodies in tick saliva and then react in a way that makes them allergic to meat. It's really wild.
That's interesting.
I kind of wanted to know in terms of, well, I guess it's two questions. I wanted to know in terms of having that tick, is it transferable to someone else? Say if you were in a wooded area, you have a tick on you and you're in close proximity with someone else. Can that tick actually transfer to another person? And is it a person to person? I know that tick, once it's on you, it kind of embeds right on that person. But if I'm in close proximity with someone else, can that tick actually move, or, am I concerned with that?
That's a really great question. It's really interesting. I don't know the answer, to be straight up, but ticks sometimes only partially feed. So I think in those situations, what you're asking could be relevant.
Okay.
If a tick were to attach and then stay on you for 3 to 5 days, fall off, it's not going to move. It's literally just laying there for a while, days.
I'm even thinking about
digest.
an animal. I'm thinking about even an animal, a dog that you're petting who has been outdoors.
Oh, yeah. Well, they could be crawling on a dog. Yeah, right. Pets. So pet owners are more likely to get a tick bite than non-pet owners. So that is a big, piece.
And for pets that have long-haired animals, would that further or increase my predisposition for getting a tick on my skin if I'm petting the there's a study out there showing that exact thing. Absolutely.
I wanted to ask about acupuncture and Lyme disease. If you wanted to talk about that.
So yes, as an acupuncturist, I love doing acupuncture. It can really help with specific symptoms. So unfortunately, the needles themselves are not going to cure someone of a bacterial infection. I wish that was possible. But it's going to help your immune system work in a better way. And we can also target pains or headaches or different symptoms that someone might have by utilizing acupuncture. And it's also working in just a very different way. It's an energy medicine. It's an ancient medicine that really has a lot of power behind it in a different way than thinking about taking a medication.
So if one of our friends listening wanted to get in touch with you for more information about Lyme disease, how can they get in touch with you? What is your website to get more information?
So to get in touch with me, Alexis Chesney, you would go to www.dralexischesney.com. And you can find my book there. I've done some signings online because unfortunately all the in-person signings have been canceled with COVID. So if somebody's interested in that, the book has some really nice illustrations of ticks like we were talking about earlier. So it can help you identify ticks. And there's a little tick card in the back that you can take with you on a hike. Yeah, thank you.
So what is the one thing you want to leave our listening audience with in preventing Lyme disease?
Prevention is the cure. Please do take this seriously. I work with a lot of people that suffer from a lot of long-term symptoms. And I think the only way at this point that we can really cure Lyme is by preventing it. I really hope we get a vaccine that works. I really hope that somebody finds the perfect treatment that cures Lyme for those people still suffering. But in the meantime, it's really about not getting that tick bite to begin with.
Thank you for being here, Dr. Alexis Chesney, author of the book Preventing Lyme and Other Tick-Borne Illnesses. We hope you stay safe and continue to do the great work that you have done and continue to do on this particular topic. Thank you.
Thank you for having me, Jeanine and Gina.
I appreciate that. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with nursing student Gina Peter. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to WHPC@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.